antibiotics in humans and animals accelerates the process. There are some common types of misuse identified in literature for the general population and for the healthcare providers. So for the general population, common examples of the misuse are using antibiotics for another purpose, not for the purpose that it was prescribed for, keeping or sharing leftover antibiotics with other people, not taking full course of the antibiotic therapy, or using them for the conditions that cannot be treated by antibiotics. And common types of the misuse by the healthcare providers include unnecessary prescriptions, choosing too narrow or too broad spectrum of antibiotic therapy, assigning a dose which is below or above the level that it should be assigned for, or choosing too short or too long duration of antibiotic therapy. WHO defines the appropriate use of antibiotics as the cost-effective use which maximizes clinical therapeutic effect while minimizing both drug-related toxicity and the development of antibiotic resistance. According to WHO, about 80% of the population worldwide uses antibiotics, and out of this use, 20 to 50% is inappropriate. It has been demonstrated that people who had an infection, patients with infections that caused by antibiotic-resistant bacteria have twice as higher mortality risk when comparing with the patients having with infections caused by the same but not resistant type of bacteria. And it was reported that in the US, at least 23,000 deaths and 2 million illnesses annually are caused due to antibiotic-resistant bacteria alone. And in the European Union, it has been demonstrated that about 25,000 deaths are annually due to antibiotic-resistant bacteria. In Armenia, there is a lack of data regarding this topic. The only study that explored the self-medication with antibiotics was conducted in 2005 by the MPH student, and the study results showed that the actual prevalence of self-medication was 12.5%, while the intended self-medication was 53.1%, and main sources of obtaining antibiotics were pharmacies. And only in the 2015, for the first time, Armenia joined the campaign World Antibiotic Awareness Week, which tries to increase the awareness and knowledge about antibiotics and antibiotic use among the population. So the aim of the study was to explore knowledge, attitude, and practice of antibiotic use among Yerevan adult population, and the study answered the following 4 research questions. What is the level of knowledge, attitude, and practice of antibiotic use among Yerevan adult population? Whether is there a difference between knowledge of and attitude towards antibiotic use and the actual antibiotic misuse in Yerevan adult population? Is there an association between socio-demographic characteristics of the respondents and antibiotic misuse? And is there an association between the expectations of and trust in providers' decision on antibiotic prescriptions and antibiotic misuse? The study utilized the cross-sectional study design. It was a telephone survey, and the general population of Yerevan who met the inclusion criteria participated in the study. The inclusion criteria were people aged 18 and above, residents of Yerevan, and willingness to participate in the study. For the data collection purpose, the study team developed a study instrument which was based on the validated questionnaires used internationally to cover the same topic. So it has 5 domains that are socio-demographic information, knowledge of antibiotic use and resistance, attitude towards the use of antibiotics, antibiotic use and misuse, and trust towards doctors and their antibiotic prescription practices. For the sample size calculation, formula for 2 sample comparison of proportions for cross-sectional studies was used, and for the one group the sample size was 226, and for the whole sample it was 452. To have a representative sample of Yerevan adult population, stratified random sampling proportionate to size technique was used, and to enroll the study participants, random digit dialing by using main codes of fixed phone numbers were used. The main dependent variable of the study was antibiotic misuse, and independent variables were knowledge, attitude, trust towards doctors, socio-demographic characteristics. Descriptive statistics for all variables were done, and to find an association between the outcome variable and the independent variable, an adjusted logistic regression was run. After adjusting for the confounders, multiple logistic regression was done. So overall 3,192 phone calls were made, and out of them one with there is contact rate of 35%, and out of this 35%, 458 had the willingness to participate to the study. Reasons for the refusals were not having the time, being not interested, or being old, not knowledgeable. Majority of the study participants were female. The mean age was 69, and 56% of them reported having a graduate or postgraduate degree, and 44% said that they are employed or self-employed. Majority of the study participants knew that inappropriate use of antibiotics reduces its efficacy and it can cause imbalance in the body's bacterial flora. About 65% of the participants disagreed that leftovers can be used again without doctor's prescription, and 63% said that the bacteria can be resistant to antibiotics. However, 43% of the respondents said that antibiotics are effective against viruses, and only 41% knew that antibiotics are effective against bacteria, and only 34% mentioned that not completing the full course of the antibiotic therapy can cause the antibiotic resistance. So the highest score for this domain was 30 and the lowest was 0, with the mean of 6.38 and the mean percent score of 49%. In the next domain, which is the attitude towards antibiotic use, majority of participants disagreed or strongly disagreed that it is good to be able to get antibiotics from relatives or friends without having to see a doctor, while 31% agreed or strongly disagreed that it is good to be able to buy antibiotics over the counter at the pharmacy without seeing a doctor. And the majority of the participants said that the use of antibiotics when you are sick in order to remain active when you have a cold is appropriate. Majority of the participants disagreed with the statement. So the highest score for the variable was 9 and the lowest was 0, with the mean of 3.51 and mean percent score of 39%. About 79% of the study participants mentioned that they have ever used antibiotics, and 26 said that they have ever started antibiotic therapy without consulting with the doctor. 11% mentioned that they usually take antibiotics for a cold, 15 said they usually take it for the fever, 24% mentioned that they usually take antibiotics for sore throat, and about 30% of the participants said that they keep leftovers at home, and out of them 33% mentioned that they use leftovers without doctor's prescription. And about 41% of the study participants mentioned that they usually stop taking antibiotics when they start feeling better. And the last domain, which is about expectations of and trust in providers' decision on antibiotic prescriptions, about 85% of the study participants mentioned that they trust their doctor's decision when they are deciding to not prescribe antibiotics, and only 66% said that they trust their doctor's decision when they are prescribing antibiotics, and 28% mentioned that they will go to their doctor from their doctor to another doctor if their doctor will not prescribe antibiotics when they think that they should. So the highest score was 6, the lowest score was 0, and with the mean of 3.17 and 61% mean percent score. In an adjusted analysis, significant associations were found between the outcome variable and some of the independent variables that are attitude score, trust in doctor score, educational level, and socioeconomic status. After adjusting for the confounders in the multivariable analysis, it has been shown that attitude score was significantly associated with the actual misuse, meaning that the higher was the positive attitude towards the misuse, the higher was the actual misuse. And trust in doctor score was also significantly associated with the actual misuse. However, the higher was the trust towards the doctors, the higher was the odds of the misuse. Having a university degree has been shown to have a protective effect towards the antibiotic use, and also socioeconomic status was significantly associated with the dependent variable. The higher was the monthly expenditure, the higher was the actual misuse of antibiotics. So there are findings that are similar to the literature and different findings. Similarly to the literature, findings include poor knowledge of the participants and confusion regarding the situations when antibiotics can be used. Also, positive attitude towards antibiotic misuse being associated with the higher odds of the misuse. Also, high educational level having a protective effect towards misuse. Different findings are that we didn't find a significant association between the misuse and the knowledge score. Uh, we found the association between higher trust in doctors being associated with the higher odds of the misuse, which is opposite in the studies done internationally, and also. While comparing with other European countries, there was a high percent of self-medication with antibiotics in this study. So the study has its strengths and limitations. This was the first study regarding the knowledge, attitude, and practice of antibiotic use in Yerevan, Armenia, and big sample size was another strength of the study. And due to big sample size and appropriate sampling approach, generalizability of the findings were assured. However, we have one of the limitations is the non-response bias, because we have very low response rate, and also all the results were self-reported, which is another limitation. So based on our findings, we conclude that there is a need for the interventions such as educational programs to increase the knowledge among general population and to change their attitude towards appropriate antibiotic use. Also, as the self-medication rates were higher while comparing with other countries, and Armenia is one of the countries where antibiotics can be obtained from the pharmacies without doctor's prescription, there is a need to ban over-the-counter sale of antibiotics without prescription, and future research regarding this topic among providers is vital to understand the current situation in Armenia regarding this topic. Thank you.
Thank you for very interesting